This time on United Way and You, we're taking a look at healthcare in our nation and region. Thank you for joining us, and please stay tuned.
Hey. Sun shines down upon us all. The air we breathe is all the same. Don't you count your bet on anyone, yeah. 'Cause the only difference is our name. Without you, there's no way. Without you, there's no way. Without you, there's no way.
Hello and welcome to United Way and You, a show about how lives change when a community cares. I'm your host, Gloria Pace King. More and more each day, Americans are struggling with affordable health insurance on a local, national, and global level. We're fighting to keep healthcare costs and insurance premiums affordable for consumers. We're fighting to control the high cost of prescription drugs and fighting to ensure that those who do not have access to health care receive the care that they need. Joining me today are two guests that are here to share their knowledge and expertise about health care in our region. Dr. William Brandon of the Metrolina Medical Foundation, a distinguished professor of health policy at UNC Charlotte, and Dr. Vernease Miller, professor of health law and ethics at Pfeiffer University, and the chair of the board of directors with Carolina's Association for Community Health Equity, otherwise known as CASH. Welcome, and thank you for joining us today.
Good morning.
Hello.
Hi, I'd like to start with each one of you. You have very distinct careers in areas of expertise, and I think it would be very good for our audience to know and understand what you do, why you do it, and how you got into it. And then we're going to get into this question of what's going on with healthcare. Bill, I'll start with you.
Sure. I am currently an academic. I teach in the political science department at the University of North Carolina, Charlotte, and I have credentials in public health as well as political science. But I got involved in healthcare first by working in a federally qualified health center, an effort to bring healthcare to low-income people in central North Carolina. Mm-hmm. The Metrolina Comprehensive Health Services here in Charlotte is the Charlotte version of this kind of community health service. Yeah.
Vernease?
Yes, thank you, Gloria. It's a pleasure to be here. I am a professor, as you've already indicated, in the Master of Health Administration program at Pfeiffer University. And my interest is in health law and medical ethics. And as an extension of my classroom work, I got involved with CASH, the Carolinas Association for Community Health Equity, and I've involved my master's students with me in terms of servant leadership. And CASH is involved in being the leading organization, the collaborative organization in the Carolinas that is dedicated to this whole issue of trying to eliminate health disparities in our community. And Bill and I have worked on this together over the years through our various higher ed institutions, and so I'm well versed with his work also.
It's a pleasure for me to have you here. I am a registered nurse and spent about the first 20 years of my career in healthcare, so it's something that is very near and dear to me, and I think underpins, you know, a lot of the safety net factors and issues, particularly that United Way agencies are trying to deal with. If health isn't one of the things that we discuss and look at the variations and what we can really do to impact people's lives, then I don't think we have the same level of effectiveness. Now, I'm sure that there might be some people who are familiar with CASH, and there might be some people who might be familiar with Physicians Network, but I'd like for you to, Bill, if I can ask you to talk a little bit about the Physicians Network, the title, United Way Agency, Community Health Services. I think that would be very beneficial for people to know about that.
I'm happy to do that. We here in Mecklenburg County need to be very proud of the fact that we're one of only a very few sites around the country where our medical society, in collaboration with perhaps some 10 safety net organizations, have united together to promise that anyone in a family with an income below 200% of poverty who doesn't have a regular source of health care and does not have health insurance can get free health care. And that is possible because the physicians in this county, through the vehicle of the Mecklenburg County Medical Society, organized as Physicians Reach Out, PRO for short, have promised to give free care to those patients, both specialty care and free primary care. The safety net organizations handle the enrollment process. Community Health Services, which is a United Way funded organization that plays a much wider role throughout the whole community in healthcare, has a staff of some 5 to 10 people that handle the administrative sides of this arrangement.
So if a person wanted to access this form of health care, how exactly does that happen? And where would they go to do it? And where would they actually receive treatment?
They would be enrolled at the Community Health Services offices on at the corner of 5th and Davidson Street.
Okay.
And their phone numbers they could call up to get direction about when to come and what sort of arrangements and what documentation they need to bring with them. Their care is actually delivered in the offices of physicians around the community. And when they are assigned a primary care physician, they take account of how far of transportation issues so that it's convenient for the patient to reach the provider.
So the Community Health Services then becomes the access point for people. So if people access that vehicle, then they can get themselves plugged into the system.
And this is, I should add, this is coordinated with Mecklenburg Department of Social Services so that if someone is eligible for the State Health Children's Insurance Program or for Medicaid, they would actually, the same paperwork could get them into those programs. So it is truly the people who don't have another provider, either public or private, that this arrangement serves. We think that among working adults in Mecklenburg County, there are about 17% who are uninsured. 17% of the population 18 to 65 don't have insurance. So there's a big population out there that needs this kind of care.
There's a huge population. Harry Jones, the county manager, is running the regional United Way campaign this season, and we are very proud to have Harry. And one of the things he talks about is the number of poor people in Mecklenburg County, and he gives a very distinct illustration of if you looked at 100,000 people in the city of Charlotte that were poor, think about the 6 towns, Menhill, Pineville, Matthews, Cornelius, Davidson, and Huntersville would all be poor. And if you look at it in that perspective, you automatically look at people who are, if they're poor, they're probably not getting their health care. And then if you look at the whole aspect of working poor, people who are working every day, but they just don't have enough money to pay for health insurance, or they're not working in jobs where they have health insurance, and then that just magnifies the issue.
Absolutely.